Handling dental emergencies, first aid tips for common issues. Dental emergencies can happen at any time, and knowing how to handle them properly can make all the difference in saving your teeth and preventing further damage. Whether you chip a tooth, knock one out, or develop a severe toothache, it's important to know what steps to take to manage the situation until you can get to a dentist. In this video, we will discuss some first aid tips for common dental emergencies so you can be prepared if the unexpected happens. Chipped or broken tooth. One common dental emergency is a chipped or broken tooth. If you chip a tooth, rinse your mouth with warm water to clean the area. If there is any bleeding, apply pressure with a piece of gauze or a clean cloth to stop it. If you have the broken piece of the tooth, try to save it and bring it with you to the dentist. You can use dental wax or temporary filling material to cover any sharp edges of the tooth to prevent cutting your tongue or cheek. Knocked out tooth. If you knock out a tooth, it's important to act quickly to have the best chance of saving it. Pick up the tooth by the crown, the chewing surface, and avoid touching the root. Rinse the tooth gently with water, but do not scrub it or remove any tissue fragments attached to it. Try to place the tooth back in its socket if possible, but if that's not an option, store it in a container of milk or saliva until you can see a dentist. Time is of the essence in this situation, so seek emergency dental care as soon as possible. Toothaches. Toothaches can be caused by a variety of issues, from cavities to infections to impacted teeth. If you have a severe toothache, rinse your mouth with warm water to clean the area and floss around the tooth to remove any trapped food or debris. You can take over-the-counter pain medication to help manage the pain, but avoid placing aspirin directly on the tooth or gum tissues, as this can cause damage. Apply a cold compress to the outside of your cheek to help reduce swelling and relieve pain. Lost filling or crown. If you lose a filling or crown, it's important to see a dentist as soon as possible to avoid further damage to the tooth. In the meantime, you can use dental cement or temporary filling material to cover the exposed area and protect it until you can get to the dentist. Avoid chewing on that side of your mouth until the filling or crown can be replaced to prevent further damage. Abscess. An abscess is a serious dental infection that can cause intense pain, swelling, and even fever. If you suspect you have an abscess, it's important to seek immediate dental care to prevent the infection from spreading. In the meantime, you can rinse your mouth with warm salt water to help reduce pain and swelling. Over-the-counter pain medication can help manage the pain, but it's important to see a dentist as soon as possible for proper treatment. Preventing dental emergencies. While it's important to know how to handle dental emergencies when they arise, it's also important to take steps to prevent them from happening in the first place. Regular dental visits for cleanings and checkups can help catch small issues before they become emergencies. Good oral hygiene practices, such as brushing twice a day, flossing daily, and avoiding sugary foods and drinks, can also help prevent dental problems. Dental emergencies can be scary and stressful, but knowing how to handle them can make a big difference in the outcome. By following these first aid tips for common dental issues, you can be prepared to manage the situation until you can see a dentist. Remember to act quickly in the case of a knocked out tooth and seek immediate dental care for abscesses or severe toothaches. And, of course, don't forget to take steps to prevent dental emergencies through good oral hygiene practices and regular dental visits.